Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you noticed, I just took my mask off. By the way, in case you wonder, this mask doesn't have any party affiliation or otherwise. I wear it because I want to protect myself and protect my loved ones. So you make the choice, but my recommendation is mask up when you need to. Dr. Zeller, Dr. Charles J. Zeller IV, D.O. That's a wonderful structure for a name. And you're a head and neck surgeon, and you're obviously an otolaryngology, which in many cases, and again, a lot of people think of it as ENT, but we'll leave it as otolaryngology. So welcome, Dr. Zeller.
Thank you. Good morning.
Good morning, sir. It's very interesting that a lot of we've been doing this now for about 22 years, and the subject matter comes from the people out there who are viewing us, and there's been a lot of comments over the last few years about sleep apnea. Can we just start out and explain to the people what sleep apnea is?
Sure. So in a broad sense, sleep apnea is one of several types of sleep disorders, and so I think probably the beginning of that conversation needs to start with what is a sleep disorder. A sleep disorder is any condition that affects your sleep quality and ultimately can affect your health. And so some common examples, aside from sleep apnea, which we'll address here in a moment, aside from sleep apnea, there are very, other sleep conditions that we all recognize. Most people kind of underestimate the effect of travel and what we call jet lag, right? Jet lag is a sleep condition, that basically folks that are traveling from time zone to time zone ultimately are fatigued and it affects their sleep quality. So that's one simple example. There's a condition called narcolepsy. Narcolepsy is a chronic sleep condition that causes an individual to have excessive daytime sleepiness or drowsiness. There is a condition called restless leg syndrome, where an individual has this compulsion to rapidly move their legs typically during the evening hours and during sleep time, which ultimately disrupts their sleep quality. And then lastly is sleep apnea, those are kind of the five major categories, I would say, as far as sleep disorders that we see. But sleep apnea being a situation in which the body has disruptions in breathing during sleep time. So there are breathing pauses, there are breathing absences during your time of sleep. That ultimately has negative effects on your health. There are two broad categories of sleep apnea that folks need to be aware of. There is a condition called central sleep apnea, in which the brain doesn't send the proper signal to the muscles of respiration. And as a result, we have breathing pauses and breathing absences during sleep. There is also what's most common, and that's obstructive sleep apnea, which is kind of the focus of what we'll talk about here, I think, later on in this discussion. And obstructive sleep apnea is a situation in which the tissues and muscles of your throat essentially collapse during the time of sleep. And as a result, the oxygen level in the body decreases, and then that has adverse effects. And so that, in essence, is what we're dealing with. I can say obstructive sleep apnea in general is the most common sleep disorder that we deal with. It affects approximately 22 million individuals in the United States currently. So it's a huge health problem. But that's in essence what we're talking about when people have conversations about sleep apnea. The majority of those cases are people with obstructive sleep apnea, where the muscles and tissues of the upper airway collapse during sleep.
Many people, I guess you could say the mature population, although I'm sure that the age is rather broad relative to sleep apnea. But many of the people that ask us questions ask us because they've had some cardiac issues or things of that nature, and the doctors wanted to do or recommended a sleep analysis, et cetera, because they had sleep apnea, or without making that statement. So I just said, let's finally bring this subject matter to the people's questions of these many, many years. And knowing that you are now I guess you could say a forerunner on the frontier of dealing with it by doing Inspire Implant, and you're going to explain what that is, because as I understand it, it's a solution to sleep apnea. So it's all yours.
Okay, thank you. I'll rotate back just a touch on what you mentioned about health providers bringing attention to patients about different medical disorders, with sleep apnea, and let me address that just for a second, then I'll address your question. So, people think of sleep apnea in general as the spouse or partner, elbows you in the middle of the night because you're snoring too loudly. And that's certainly, snoring is a component of what we see frequently in folks that suffer from sleep apnea. That is very true. The other issues that we deal with are, excessive daytime sleepiness, unexplained. And I have patients that will come to me who are actually, almost medically disabled because they can't function during the day because of untreated sleep apnea. There are issues with folks that are professional drivers, for example, or just driving in general, where you have excessive sleepiness, you doze off at the stoplight, things like that. That puts somebody in danger. Those are the three kind of common attributes that you associate with sleep apnea, but the medical effects are important. And I think that's something we should just briefly touch on. I mean, untreated sleep apnea has been shown to affect one's aptitude, concentration ability. There's a direct correlation to increased blood pressure with untreated sleep apnea, increased risk of irregular heartbeats, such as atrial fibrillation, increased risk of heart attack and stroke. And then ultimately, kind of the end result of poorly treated sleep apnea is heart failure. So these are big issues for people. So that, it was interesting how my practice evolved more into a sleep practice, but there's such a need. As I mentioned before, 22 million people in the United States suffer from obstructive sleep apnea. To get back to your question just recently about Inspire. So there are, I guess, several broad categories of treatment for obstructive sleep apnea. Traditionally, and probably the most common treatment that we see, certainly worldwide, is called CPAP. CPAP being continuous positive airway pressure. It is a machine that blows air through a tube hooked up to a mask on your face or nose that creates a positive pressure in your upper airway so that your tissues don't collapse during sleep. And on average, I would say it's probably about 50% of the folks that I see in my practice, and I think that is represented just statistically as well. 50% of the folks either are intolerant of CPAP or inconsistent with its use, and so in those situations they're not receiving any positive treatment towards their condition. Secondly, there has been recently kind of an advance on dental appliances, oral appliances. So there are certain dentists and oral surgeons that are trained specifically to take specific measurements and do imaging on the mouth, jaw, throat area, and create specific devices that the patient would insert before bedtime that helps to maintain their airway. There are two broad categories of those oral appliances, one that brings the jaw forward or the mandible forward, and one that brings or helps to stabilize the tongue so that the tongue doesn't fall back in the throat during sleep. And then the last category of treatment, broadly speaking, is surgery. Traditionally, the surgery from a head and neck, ear, nose, and throat standpoint has focused on addressing any element of obstruction of breathing through the nose, and then also looking at potential areas of tissue collapse in the throat area. Those are, in particular with the throat surgeries for sleep apnea, they are anatomy altering surgeries and require a significant amount of healing time, downtime for the patient, a lot of discomfort. And quite honestly, over the years, I've been in practice for 18 years now. The improvement that you gain from that type of a procedure is really marginal, I would say, compared to what we have now to offer with the Inspire implant.
Inspire is the only FDA-approved obstructive sleep apnea treatment that treats the root cause of sleep apnea with just the click of a button. Inspire is a small device that keeps your airway open using a gentle pulse. It's implanted in the body with 3 small incisions in a same-day outpatient procedure. After the procedure, Mike works with his doctor to fine-tune his Inspire. Once it's fine-tuned, Mike simply clicks the remote to turn on Inspire and goes down to sleep. While Mike is asleep, Inspire monitors his breathing. Every time he takes a breath, a gentle pulse moves the tongue out of the way and keeps Mike breathing freely. And more importantly, sleeping soundly, the way he used to. This has been a total game changer for Mike. Mike is getting more out of life and back to being his old self again. No mask, no hose, just sleep.
It's a very gentle electrical stimulation. Patients are not awakened from the stimulation. It's the way the whole system works is, so the surgery, first of all, there's a series of processes in evaluating a patient for Inspire. We look at in the office whether you have obvious nasal obstruction, whether you have obvious throat obstruction. Then the next step is that we look at a sleep study, as you mentioned. The sleep study in particular, for Inspire, for a patient to be a candidate for Inspire, they have to have a sleep study that demonstrates either moderate or severe obstructive sleep apnea. They cannot have a significant central component to their apnea. So it has to be obstructive. It has to be the tissues are collapsing in the upper airway. As long as they're moderate or severe in nature, and and they've tried the traditional therapies, which are, as I mentioned, oral appliances or CPAP, and they're intolerant of those, then we start to look at whether or not they're a candidate for the Inspire implant. As I mentioned, in the office, I see them for an initial evaluation. Do a typical head neck examination. Then we bring them back for an endoscopy in the office, which is simply a small camera that's passed through the nose that looks at the nasal cavity, that looks at the throat to see if there's any obvious areas of obstruction of the airway. And then lastly, in the process for getting towards Inspire, we do what's called a drug-induced sleep endoscopy. So that's a situation that's rather unique to Inspire, but it's very, very critical in determining who's going to benefit from the surgery. the drug-induced sleep endoscopy, or we call it DISE, D-I-S-E. So the drug-induced sleep endoscopy is one final way of looking at the pattern of airway collapse for that patient. And provided they have that particular pattern where the tongue is falling back and blocking the airway during sleep, then we determine that they are a good candidate for the Inspire implant.
Okay, let me ask you, firstly, we did get a couple of questions from viewers in this area of sleep apnea that, and again, I don't know, again, I'm just referring to their question. A couple of questions were that I wake up in the morning and my mouth is dry. I mean, I'm absolutely dry. Is that an indication of sleep apnea?
It certainly is an indication of nasal obstruction. So, one of the things that we see with folks with obstructive sleep apnea very commonly is they'll have that complaint of being a mouth breather, right? So they, throughout the night, their mouth is dry when they wake up with a dry mouth. And to some degree, the snoring that we spoke about, if you think of it from a standpoint of, we have two, inputs for airflow, during sleep. We have our nose and we have our mouth, two inflows for breathing in general. And in an individual that has nasal obstruction, commonly, their mouth will be open during sleep. They'll snore more loudly. And over time, the mouth breathing that we see commonly with folks with obstructive sleep apnea actually causes I would describe it as almost a dragging or vacuum effect on the back of the throat, the area that we call the soft palate. So when you open your mouth, you say ah, and you look, you'll see what I commonly call, the uvula, but I refer to it as the little hanging down thing in the back of your throat. So over time, that vacuum effect with mouth breathing drags on the palate, elongates and thickens that uvula, softens the tone of that muscle, and people will have more and more obstruction. So that's, to answer the question, I guess, in a verbose way. The mouth breathing very commonly indicates nasal obstruction. And yes, it is tied very directly to patients with sleep apnea.
This is not a true medical question, but it's also come to mind that in this device, it is battery driven, correct?
It's a self-contained battery device. It comes in a generator, so it looks. And I wish I should have grabbed a dummy model of it. I have it just in the office next door. But it's a small circular device. The battery is self-contained. As I mentioned, the implant is placed in the upper chest, just below the collarbone. And the battery life for that device is said to be up to 11 years. The technology is rather new. I do have experience doing a very similar nerve stimulator implant called the vagal nerve stimulator, which is used for patients with epilepsy. And my experience with that over the years is the battery life is about 7 to 8 years. And then with that, then the replacement. So once your sleep specialist, I guess that's an important discussion here real quick. I'll circle back. The Inspire implant really requires a multidisciplinary team. So it's not just the surgeon that is involved with implanting the device, but it's also your sleep specialist who's trained with Inspire, that's trained in programming the device and also monitoring how well it's doing for you. And so as the device, as the battery would begin to wane over the years, that would be conveyed to me eventually that it needs to be replaced. And then that process is a very simple 30-minute outpatient surgery where we would just replace the generator of the Inspire device.
We're down to the last 4 minutes of the show, and I've been inspired by your Inspire.
This is the Inspire device. Again, it resembles almost what looks like a pacemaker. It's implanted here. The surgery to place the device and to start the process for Inspire is an outpatient procedure. It takes about 2.5 to 3 hours, but you go home the same day. The recovery is 5 to 7 days of just taking it easy. Pain control typically is just over-the-counter medications for folks.
But it's an outpatient surgical procedure.
It sure is. Absolutely.
Okay. Let me just, again, we're down to the last 2 minutes of the show, and I think our people are clearly, you're giving them the answers relative to sleep apnea, and I'm very pleased that we've had you on the show today, because I think this is so unique to a very specialized audience. But the one quick question, and we're going to have to do this in 30 seconds, is sleep apnea a condition that is ageless? I mean, does it occur at a young age as well as a late age?
Absolutely. There's no age discrimination with sleep apnea. We see it very commonly in children with enlarged tonsils, enlarged adenoids. They have airway obstruction because of that enlarged tissue in their throat. So absolutely. And one thing that I would stress, with Broward Health in particular, we have a sleep disorders clinic that looks at all of that, looks at pediatric populations for sleep disorders, looks at adult populations, because it is an ageless condition. That is true.
Well, thank you. Dr. Charles J. Zeller IV. There must have been a heck of a family, I can tell you that. And we're very proud to have you on the show. There's been a subject matter that's come up over the years, and I just did not know how to bring it here. We've had colleagues of yours who do sleep studies, but we just couldn't hone in directly on the sleep apnea situation. And I'm very, very pleased that you're here to serve the South Florida area. And I think the whole issue of Inspire is inspirational. How about that? And I really appreciate your knowledge and your willingness to bring that information to our viewers. So thank you both. Thank you very much, both the Inspire unit and you. Okay. Do me a favor. Stay in touch with us because we are considered. I know Midwestern very well. Midwestern University. I did some consults for them in Arizona. So, but feel free to always come and visit Nova Southeastern University, and one of the finest osteopathic medical schools in the United States. So thank you, Dr. Charles J. Zeller. We wish you nothing but the very best. I think your work is very important. Knowing my involvement with the world of cardiology, often there is always that issue of sleep apnea, and I think that you brought the attention to our viewers as to a solution. So thank you. Folks, as I always tell you, you got to take good care of yourself, and the way you care for yourself is, for example, Dr. Zeller said, all of a sudden you're sitting at a red light and you're dozing off. I think you ought to get yourself checked. Remember, this show is called Dateline Health. It's your show, so there's an address and a connect number here if you get onto your computer. If you have any questions, just let us know. And as I always tell you, the show is yours. So if you have any issues and comments for the future, just let us know. My name is Fred Lippman. We come to you from Nova Southeastern University. Until next time, see you.